the world of weight management has seen extraordinary advancements in recent years. And among the most significant breakthroughs is the emergence of GLP-1 medications for weight loss. These drugs, such as Wegovy and Zepbound, are transforming the landscape of obesity treatment, offering new hope to millions who have struggled with weight control. But what exactly are GLP-1 medications? How do they work? And what should you know before considering them as part of your weight loss journey? To truly appreciate the potential of GLP-1 medications, it's essential to first understand the science behind them. GLP-1 stands for glucagon-like peptide 1, a naturally occurring hormone in the body. When you eat, your intestines release GLP-1, which stimulates insulin secretion, reduces blood sugar levels, and, importantly, signals your brain to feel full and satisfied. In people struggling with obesity, these signaling pathways can sometimes be less effective, resulting in persistent hunger and challenges in regulating food intake. GLP-1 medications are designed to mimic the effects of this hormone, amplifying the body's natural satiety signals. By doing so, they help reduce appetite, decrease food cravings, and enable people to feel full with smaller amounts of food. This leads to a significant reduction in calorie intake and, over time, weight loss. Wegovy and Zepbound are two prominent examples of GLP-1 receptor agonists now available for weight management. Clinical trials have shown that these medications can help individuals lose a substantial percentage of their body weight, often far more than with lifestyle changes alone. Yet, experts emphasize a crucial point. Medications like these are tools, not magic solutions. Sustainable weight loss, and especially long-term health, still depend on foundational lifestyle habits. Why is this distinction so important? While GLP-1 medications can be remarkably effective in suppressing hunger and supporting weight loss, they do not address the root causes of obesity, nor do they replace the need for a healthy diet, regular physical activity, and other wellness practices. For those who see these drugs as a shortcut, disappointment often follows. For those who embrace them as part of a comprehensive approach, including mindful eating, regular movement, and emotional well-being, the results can be transformative. Among the many health concerns related to excessive weight, visceral fat, also known as belly fat, stands out as particularly dangerous. Unlike the fat that accumulates just under the skin, visceral fat lodges deep within the abdominal cavity, surrounding vital organs like the liver, pancreas, and intestines. This type of fat is metabolically active, releasing inflammatory substances and hormones that disrupt the body's normal functions. The consequences of visceral fat are profound. It's a key contributor to cardiovascular disease, raising the risk of heart attacks and strokes by promoting high blood pressure, abnormal cholesterol levels, and inflammation. It is also closely linked to insulin resistance and the development of type 2 diabetes, as well as certain cancers. Reducing visceral fat is therefore not just a matter of appearance, it's a critical priority for long-term health. So, how can you effectively target and reduce belly fat? Experts consistently highlight 3 golden strategies: high-intensity interval training, HIIT, blood sugar management, and adequate sleep. High-intensity interval training, or HIIT, is a form of exercise characterized by short bursts of intense activity, alternated with periods of lower-intensity movement or rest. Studies have shown that HIIT is particularly effective at mobilizing and burning visceral fat. This is because the intense effort required during HIIT workouts taxes the body's energy systems, leading to greater post-exercise calorie burn and a more significant reduction in abdominal fat stores compared to steady-state cardio. Importantly, HIIT doesn't require hours at the gym or complex equipment. Simple routines, such as sprinting, cycling, or bodyweight exercises, performed at maximum effort for 20 to 30 seconds, followed by a minute of rest, repeated several times, can yield impressive results. For those new to exercise or with medical conditions, it's wise to consult a healthcare provider before starting any high-intensity program. The second key is managing blood sugar. Consistently high blood sugar levels drive the storage of fat, particularly in the abdomen. To keep blood sugar in check, focus on a diet rich in whole, unprocessed foods. Favor vegetables, lean proteins, whole grains, and healthy fats, and limit the intake of refined carbohydrates, sugary drinks, and processed snacks. Eating regular, balanced meals and being mindful of portion sizes can also help stabilize energy levels and reduce the likelihood of overeating. The third golden key is sleep. Many people underestimate the power of restful sleep in supporting weight loss and reducing belly fat. Inadequate sleep disrupts the balance of hunger and satiety hormones, leading to increased cravings, especially for high-calorie and sugary foods. Chronic sleep deprivation also raises stress hormones, which can further promote fat storage in the abdominal area. Aim for at least 7 to 8 hours of high-quality sleep per night, prioritizing a consistent sleep schedule and a calming bedtime routine. While these three pillars, HT, blood sugar control, and sleep, are essential, it's important to remember that successful weight management is a holistic endeavor. Emotional health, social support, and self-compassion all play vital roles in sustaining healthy habits. It's normal to encounter challenges and setbacks along the way. What matters most is the commitment to getting back on track and learning from each experience. Returning to the role of GLP-1 medications, it's clear that they offer a valuable tool for those who have struggled to lose weight through diet and exercise alone. They can help level the playing field by reducing the physiological drive to eat, making it easier to adopt and maintain healthy behaviors. However, medications like Wegovy and Zepbound are not suitable for everyone. They are typically prescribed for individuals with a body mass index, BMI, above a certain threshold, especially those with weight-related health conditions. Like all medications, GLP-1 drugs can have side effects. The most common are gastrointestinal, such as nausea, vomiting, diarrhea, or constipation, which usually improve over time. Rarely, more serious complications can occur. Regular follow-up with a healthcare provider is essential to monitor for any adverse reactions and to ensure the treatment is working as intended. It's also important to set realistic expectations. While GLP-1 medications can help people lose significant amounts of weight, they do not guarantee results for everyone. The greatest benefits are seen when these drugs are combined with a comprehensive lifestyle program. Moreover, if the medication is stopped, weight can often return unless lasting changes in eating and activity patterns have taken root. The conversation about weight loss is often fraught with emotion, judgment, and frustration. For many, repeated cycles of dieting and weight regain can erode self-confidence and hope. GLP-1 medications represent a promising new chapter, but they are not the only answer. Success requires a shift in mindset, from seeking quick fixes to building sustainable habits and nurturing a healthy relationship with food and body. To embark on a successful weight loss journey, whether with or without medications, consider adopting a few guiding principles. First, focus on progress, not perfection. Small, consistent changes add up over time. Celebrate every step forward, no matter how minor it may seem. Second, prioritize nourishment over restriction. Choose foods that fuel your body and support your well-being, rather than obsessing over calories or rigid rules. Third, cultivate movement that you enjoy. Physical activity should be a source of pleasure and vitality, not punishment. Whether it's dancing, hiking, swimming, or playing with your children, find ways to move that bring you joy. Fourth, surround yourself with support. Connect with friends, family, or communities who share your goals and values. Encouragement and accountability can make all the difference. Finally, practice self-compassion. Weight loss is rarely a straight path. There will be ups and downs, successes and setbacks. Treat yourself with kindness, patience, and understanding. Remember that your worth is not defined by a number on the scale. In summary, GLP-1 medications such as Wegovy and Zepbound are revolutionizing the field of weight management, offering new hope to those who have struggled with obesity. By harnessing the body's natural satiety signals, these drugs help control hunger and make it easier to adopt healthier habits. But medications are only one piece of the puzzle. The foundation of long-term success lies in a healthy lifestyle, especially when it comes to reducing dangerous belly fat. Targeting visceral fat should be a top priority for anyone seeking to improve their health. High-intensity interval training, blood sugar management, and adequate sleep are 3 proven strategies to help achieve this goal. Together, they address the root causes of excess fat storage, support metabolic health, and reduce the risk of chronic diseases. For those considering GLP-1 medications, it's essential to consult with a knowledgeable healthcare provider, understand the potential benefits and risks, and commit to a comprehensive approach that includes nutrition, exercise, sleep, and emotional well-being. Weight management is a journey that requires patience, perseverance, and self-care. The science of obesity is complex, and there is no single solution that works for everyone. But with the right tools, support, and mindset, lasting change is possible. Whether you're just beginning your journey or seeking new strategies to overcome a plateau, remember that every step you take toward better health is a victory. Embrace the process, honor your progress, and trust in your ability to create positive, lasting change. The path to a healthier, happier you is within reach, one informed choice at a time.